Myles Copeland is the Cabinet Secretary of the State of New Mexico's Aging and Long-Term Services Department. In that capacity, he's responsible for leading the department, which offers adult protective services, connects consumers with resources for elders, people with disabilities, and their caregivers, and provides funding and technical assistance for statewide senior services, including meals, transportation, health promotion, and caregiver support. Try to say that without reading. Prior to his designation as Cabinet Secretary in July 2015, he spent 2 years as the department's Deputy Secretary. And he's also known to all of us because he came to the department from the Alzheimer's Association New Mexico chapter, which is a chamber member. And there he managed the Veterans Savvy Caregiver Support Program, as well as legislative advocacy, volunteer and public awareness efforts. And he has an MBA from UNM and a bachelor's in philosophy from Whittier College in Whittier, California. And with that, I give you Myles.
Thanks a lot. Thank you, Nancy. Sorry for the long introduction there. So I'm here today to talk to you about family caregiving here in New Mexico, and we'll focus on 2 different roles that you might have. If you are a family caregiver, we will talk to you about what implementation of the New Mexico State Plan for Family Caregivers means for you and your role in that. And if you're an employer, too, there are specific things that we are looking to you to help us accomplish that will help you as an employer with your employees who are doing family caregiving, and then in turn help them, too, to do their family caregiving for longer. So the reason that we found the need to put together a New Mexico State Plan for Family Caregivers is the scope of it. We'll talk about that. We'll talk about some of the challenges involved with family caregiving here in New Mexico. We'll talk about the process that we went through to develop this plan, some of the resources that are available, and then those couple of roles that I mentioned before. We have 419,000 folks here in New Mexico each year that do family caregiving. If you are someone who has had to take your mom or even your spouse to the doctor's office on a regular basis, had to manage their medications, maybe had to make meals, handle transportation, do hygiene, do toileting, you have been a family caregiver. These are people who are unpaid, who do caregiving, do tasks for their loved one on a regular basis. Here in New Mexico, I mentioned 419,000 per year. On any given day, it's about 287,000 people. So annually, it's about 20% of our population that is engaged in family caregiving. And they do an awful lot of it. About 18.5 hours per week is what it takes for them to be a family caregiver. So it's a part-time job, essentially, and we'll talk about what the implications of that are. Also, they provide about 80% of all of the long-term care that gets provided here in New Mexico. So while we think about assisted living facilities and nursing homes or professionals who come into your home to provide care, it really is family caregivers who are the backbone of long-term care here in New Mexico and throughout the nation. We know that if you are a family caregiver, the reason that you do it is because you love the person that you're taking care of, right? You feel a responsibility to them. You want to see them safe. You want to see them do well. I'm here to tell you that from the state's perspective, that's all well and good, but you are saving us a whole lot of headaches that would otherwise fall more directly on government systems. As the department that runs adult protective services, we see the bad things that happen when there is no family caregiver, because about 2/3 of our cases substantiated in adult protective services are self-neglect. People who are trying to live in their own home, but just aren't able to do it anymore and don't have sufficient supports to continue to live safely that way. And that's one of the reasons that it's important to us to support family caregivers. Other things that wind up being burdened in the absence of family caregiving are things like Medicaid, paying for long-term care facilities, for nursing facilities, for people who fall into that wealth demographic there. So there's an awful lot of benefit that the state sees in what it is that family caregivers provide, and consequently in supporting that work of family caregivers. So because of all of this, we found the need to develop a strategic plan to family caregiving. Like any decent strategic plan, what we did was to identify what the ideal state is for family caregivers, look at where we're at right now, the resources that are currently available, and then come up with strategies for bridging that gap between where we want to be and where we're at right now. We took into account, too, things like rurality, things like diversity, things like the fact that we are a poor state here in New Mexico, and finally, that whatever recommendations we came up with had to be implementable. They had to be viable in our current resource environment. So things like paying all family caregivers through a PCO program expansion, we knew that there just would not be the money for that, right? Those would be recommendations that would go nowhere and really make this plan less implementable and consequently something that people would take less seriously. So we stuck to things that we feel like we can get done by and large with either the resources that we have right now or maybe a modest expansion. So those were kind of the parameters that we were operating in. Anytime you are trying to do a plan for a population, you better talk to that population, right? It doesn't do you any good to come up with recommendations that don't fill the needs that they see. So we were very lucky that AARP funded a study of 1,000 folks here in New Mexico, oversampled rural areas, made callbacks to non-English speaking homes so that we got a representative population opinion that informed this plan. It was really the driving force behind the recommendations that we came up with here. We're seeing an awful lot of growth in family caregiving, just like we are in everything else that's associated with our baby boomer population. So the segment of our population that is most in need of care is people who are 80 and older. And then typically the people who are providing that care are between 46 and 64. That's the prime demographic for doing caregiving. They talk on a national level about the caregiver ratio. And so that's the number of folks in that 46 to 64 demographic versus the number of people who are 80 and older. And right now that stands at about 7 to 1. Over just the next 14 years, by 2030, that shrinks to 4 to 1, and then by the middle of the century is down to just 3 to 1. So we're going to have fewer and fewer people to provide care and more people who are going to need that care. In terms of the effect of that here in New Mexico, we expect all of this to be even more pronounced. So on our tribal lands, what we have are folks who move away during their working years, during their career, and then come back oftentimes as elders when they're going to be more likely to need that care. So those caregiver ratio problems that we're expecting to see nationally are even more pronounced on our tribal lands. Hispanics, Native Americans participate in caregiving at a greater ratio than the population at large. And it's still women who do the majority of family caregiving nationally and here in New Mexico. It's about 60-40, the split between men and women. Men are doing much more of our share than we used to. I think about 2000 or so, it was about 28% of the care was being provided by men. So we've stepped up a little bit in terms of what we provide there. Whether you come to family caregiving slowly over time as your loved one ages, maybe has chronic conditions that are deteriorating their level of functionality, their level of independence, like diabetes, like heart disease, both of which are risk factors for Alzheimer's disease and for other dementia, or you come to caregiving all of a sudden because you have a loved one that has a stroke or an accident. None of us come to it prepared, and we wind up doing an awful lot. So maybe you start off taking your loved one to doctor's appointments, then you're checking to make sure that they're managing their medications appropriately. Then maybe they lose the ability to drive, you convince them to give up their car keys, and you're doing all of the transportation. And you wind up doing all of the cleaning, all of the cooking, hygiene tasks like showering, you're getting them dressed, you're getting them in and out of bed eventually. It winds up being an awful lot. and none of us go to school to become family caregivers, and even those of us for whom it is our job throughout our life to take care of other people, it's amazing how those skills don't transfer when it's your own mom or dad that you are taking care of. It winds up going out the window oftentimes. And so we need to do a better job with training folks in these tasks because we are not prepared for them by and large. Not only are our family caregivers doing an awful lot of different things, but a third of them are also doing it for more than one person. And consequently, they wind up being very stressed out. So you can find studies that will talk about some of the benefits of family caregiving. But when you look at meta-analyses of these studies, what you find is that for caregiving in general, we suffer mild to moderate negative impacts to our physical and psychological health. And then when we're talking about caregivers of Alzheimer's disease and other dementia, those move to moderate to severe negative impacts. So overall, it is hard on family caregivers. And here in New Mexico, the findings of that AARP study backed up what you see nationally. Our family caregivers here in our state feel stressed out, they don't get enough rest, they don't get enough exercise. Overall, they're being worn down over time. And so we need to look at ways to help support them and to give them a little bit more of a break than what they're getting right now. Financially, family caregiving takes a tremendous toll. So we pay on average during a caregiving experience about $5,000 out of our own pocket for the care of our loved one. If you are a family caregiver who is 50 and older and has to leave the workforce to take care of your loved one, the impact of that is devastating. So on average, it's about $300,000 that you lose in terms of current wages, future Social Security benefits, and pension benefits. And if you're a woman, it's almost $325,000 that you are giving up to do family caregiving if you are in that position. This is one of the reasons that we have brought this focus to supporting our working family caregivers, because it benefits them and it benefits the state to maintain them in the workforce. Because otherwise, in this situation, we wind up setting them up to, in that stage of their life, when they're 80 and older and needing care, to not have the financial wherewithal to pay for some of the things that are going to help keep them safe, right? So we want to help our family caregivers right now so that later in life, they're going to have some ability to be able to support themselves. We don't want to put them in difficult situations because they have made the hard and responsible choice of taking care of their loved ones. That's what we want to stay away from. So we'll talk now about some of the supports that are available right now for family caregivers. As came up with a couple of folks that we've talked to just prior to this presentation, it is very difficult to find your way to the resources that are available as a family caregiver. Our system of long-term services and supports both nationally and here in the state is complicated to navigate, not intuitive, doesn't effectively pass people from one resource to another, and that's one of the things that we need to do a better job with and that we're working on currently. The number one thing that family caregivers said that they needed when we talked to them in this AARP study is information about resources. So I think when I went into this, I was expecting them to want some sort of new program, to want different resources. But what they said is that they can't even get right now to the resources that are currently available to help them out. And so that's something that we can and are doing a better job with, making things more effective and better connected so that we're able to walk people from one thing that they need to the next thing that they need and make their life more manageable just with what we have currently out there. Our answer to that problem from the state perspective is the Aging and Disability Resource Center. We have brochures there for you. If you are an HR representative or you are your own HR, as so many of us are when we're in smaller towns in New Mexico, running our own businesses, everything falls on you. it is very nice to have a resource that you can point employees to that costs you nothing. So I mentioned before the way that tasks stack up on us as family caregivers. And the way that that happens, we never take account of all of the different things that we're doing, right? We're kind of bouncing from one crisis to the next, taking on more and more without doing an inventory of everything it is that we're doing. One of the nice things that the Aging and Disability Resource Center does is to assess the caregiver, figure out what it is that they're doing, figure out from a directory of 4,400 different resources here in New Mexico what's available in their community to help meet those needs that they have and maybe haven't even recognized, and then connect them with the things that are going to make their life easier. So they do a needs assessment, they look at the resources in your community, and then make that connection between you as a family caregiver and the things that are available to help you out. So I encourage you to take some of those brochures, use them for yourself, use them for your employees who are in this situation. The other big sources of care coordination are local. And local is always better, is what I realize from a state perspective, right? I mean, there's an awful lot that we can do in terms of providing funding, sometimes providing technical assistance, but whether someone gets to what it is that they need winds up happening right here in Los Alamos and maybe in your senior center, right? There's nobody who knows your resources and the people who are actually going to be helpful as well as the people in your community who deal with that on a daily basis. That's one of the reasons that support groups are so valuable, right? They at the Aging and Disability Resource Center can tell you that this resource is available, but they can't tell you whether or not it's any good, right? The way that you find that out is really through peer referral. And so we'll talk about the central role that support groups play too. You have social workers that help in hospital settings and nursing home facilities. Places like senior centers can help you with that resource connection because they know the things that your mom, your dad, maybe your spouse are facing and are able to connect you with the resources in your community that are going to be useful for that. One of the great things that got done in the 2014 legislative session was the passage of the Lay Caregiver Aftercare Designation Act, a name that you don't have to remember. But what you should remember is that when your loved one now goes into a hospital, hospitals are supposed to ask you, or ask the loved one, whether they want to designate a family caregiver. If they do, the hospital is then supposed to train that family caregiver prior to discharge in the things that are going to make your loved one successful when they move back home. This is a good thing for you individually, and there's more and more emphasis being placed on the importance of successful transitions, right? Under the Affordable Care Act now, hospitals incur financial penalties in their reimbursement rates if they have reimbursements within certain time frames, right? So there's a lot that is working in favor of placing better emphasis on training family caregivers because, as I said before, they wind up doing most of the work when the person moves from a hospital or a nursing home or assisted living facility back into the community. It really is you who's going to make sure that the person either does okay or doesn't and winds back in the hospital. And now hospitals have a financial incentive to make that transition better. And so it behooves them to train you. Many of us have been in a situation where we're just trying to either get ourselves out of a hospital or get our loved one out of a hospital, and either we aren't trained or we don't do a very good job of listening when we are being trained because we're just focused on getting the heck out of there. And then you get home and realize you don't remember or weren't told what it is that you need to do to help out your loved one, how to administer the medications, how to clean wounds, how to manage the medical equipment, right? All of that winds up becoming very important in a moment. And if you haven't been trained on it or weren't trained at a time when you were able to pay attention, that creates big problems and puts people back into the setting that they just got out of many times. In terms of training and planning, we recognize that we need to do a better job with that. So our caregivers echoed this. With planning, we have an opportunity to take burden off of our loved ones, right? Any decision that I make for myself is something that somebody else doesn't have to decide for me, right? This winds up being particularly important in terms of things like advance directives, powers of attorney, deciding your financial matters in advance. By the time you need to do all of that, it's too late, right? And many of us have been in situations where you wind up fighting with your brothers and sisters because you have different understandings of what it was that mom or dad wanted, right? You see the havoc that that wreaks on family caregivers, on families when those decisions aren't made in advance. Our hope is that people who are in that situation realize the difficulty of that and make their decisions in advance because they've seen the trouble that it creates when that is not done as a family caregiver. So that's the planning portion of it. In terms of training, I've talked to a couple of people right before this who were dealing with dementia in their own family. And because of the difficulty that I highlighted before relative to dementia caregivers, we have put particular emphasis on the training that's offered for dementia caregivers here in the state of New Mexico. So we have 105,000 folks who do family caregiving for loved ones with Alzheimer's disease and other dementia. And up until about a year and a half ago, we were relying on 5 Alzheimer's Association staff members to try and train all those caregivers. And the math on that obviously does not work out, right? So what we have done is to train volunteers around the state in this program called Savvy Caregiver. So because of the dynamics with Alzheimer's disease, inevitably it's your mom or your dad or your spouse that you're trying to take care of in these situations. It's always somebody who hasn't listened to you the way that you wanted throughout your life, right? And because of that, there is a tendency to confuse the impacts of Alzheimer's disease with just an extension of that, right? They keep asking you the same question over and over again because they just aren't paying attention to you. Among the quick things that I can tell you about that this class teaches is that even if you were to win an argument with somebody with Alzheimer's disease, they're not going to remember in 10 minutes that you did anyway, right? So you are much better served by taking a more clinical approach and yes-anding them, right? Just agreeing with them and redirecting them and moving on in most situations. That is going to make your life as a family caregiver easier and their life as a care recipient easier too. This class is offered for free throughout the state, through the Alzheimer's Association, and now through a network of volunteers. So in a year, they trained about 60 folks throughout New Mexico to deliver this class. And I mentioned before that when we're doing things here in New Mexico, we have to make sure that they're relevant and usable across cultures, across our very rural state. And the way to do that is to localize knowledge. You don't need some jerk from Santa Fe coming from outside to tell you how to do things, right? That creates problems as far as outreach goes, as far as local competency, cultural competency goes. If you train somebody in the community in this evidence-based class, then they know the people in your community who are going to benefit from this education. They're able to connect with those folks, and they're able to communicate it in a way that makes sense for your locality, for your region there, right? So that's why we have taken this approach. That's what we're doing specific to caregivers of Alzheimer's disease and other dementia. There are several different options for just physical caregiving tasks, right? So most of us don't know the best way to get somebody out of a wheelchair and into bed, or vice versa, get them into the shower, onto the toilet, all of the more difficult physical tasks that need to get done as a family caregiver. There's a nonprofit called the New Mexico Direct Caregivers Coalition that offers education on that. We'll highlight some of the online instruction that's also available for that. And many of your private home care agencies will also train family caregivers. The thing to be aware of there, obviously, is that their ulterior motive is on down the road when you need help from someone outside of your home to come in. They're hoping that you turn to them for that. But as long as you go into that with your eyes wide open, from the state's perspective, we want you to get trained. And so long as you're not getting taken advantage of, that's all well and good with us. I mentioned before that every decision that you make for yourself is one less decision that somebody else has to make for you, saves the headache that is created within a family, allows for you to make the decisions and live that part of your life the way that you want to live. We need to make sure that we are doing a better job with keeping ourselves healthy in the long run. So just like every decision that I make is one less decision that somebody else has to make, everything that I'm able to do for myself is one less thing that my family caregiver has to do for me. It takes something off of their to-do list. And so this creates even more urgency around taking care of ourselves as we age, right? There are lots of things that we won't do for ourselves that we'll do for our kids, right? I have a 7-year-old daughter, so I do lots of silly princess things that I would never choose to do on my own, right? What we're hoping is that family caregivers see all of the work that they have to do because maybe mom or dad, your loved one, could have taken better care of themselves in their midlife, later in life, so that they were more functional. Right? Maybe drink a little bit less, maybe eat a little bit better, maybe exercise a little bit more. And we're hoping that, having seen that it doesn't just impact me, right? I mean, a lot of us think, well, you know, I don't care about myself. I'll have a couple of donuts instead of just one donut. You realize that that has impact beyond just yourself, right? I mean, it's easy to make a decision that's not in favor of your own health when you're thinking just of yourself. But you need to broaden that thinking and think about the trouble that that creates outside of yourself as you age. And so because of that, we're hoping and are doing public awareness around getting people to take a better care of themselves from that perspective. There are things that we will do for ourselves and won't do for ourselves that we would do when we see the trouble that it creates in our larger community. Enhanced fitness and other fitness classes offered through your senior centers are one of the solutions to that. As we age, New Mexico Senior Olympics does a great job statewide finding events for anybody, regardless of what your interest is, what your physical fitness level is. Manage Your Chronic Disease is an evidence-based program that we offer in conjunction with Department of Health around the state that does exactly what it suggests. Helps people to manage things like COPD, heart disease, diabetes, so that we maintain a quality of life and a level of function as we age. Respite is obviously very important. We talked about the stress that family caregivers are under, and our family caregivers recognize that they need to get a break. So there are some sources of that through your senior centers, through the Alzheimer's Association. They offer a very flexible respite reimbursement program that is not an awful lot of money, but also is available in emergency situations. Let's say that you are a caregiver and suffer some sort of health emergency, or maybe even just have to go out of town unexpectedly. They offer extra respite reimbursement during those periods. And there's not an element of financial need with that, so that there's not a threshold for you to qualify other than having a diagnosis of dementia and being the primary caregiver for your loved one. Volunteers are particularly important throughout the implementation of this plan, and we already have a volunteer program here in the state of New Mexico called Senior Companions, where these people go and sit with frail elders, help to keep them safe, and give a little bit of a break to family caregivers. So those are some of the sources of respite. Obviously, private home care agencies serve that function too. And we need to do a better job with activating more people in our social networks to help out with family caregiving. So if you're a family caregiver, word typically gets around and people ask how you're doing and if there's anything that they can do to help. And our answer is always, I'm doing fine. No, you don't need, there's nothing really that I need, which is really a lie, right? None of us as family caregivers are doing that great, and we always could use more help. We need, as family caregivers, to be able to accept that help and to be more flexible about the way that that help comes to us and what that help looks like. So if you are looking for somebody to come into your home and take care of mom exactly the way that you do, you're out of luck. That's not going to happen, right? Whether you are talking to a neighbor or to another member of your family, that's just not a viable thing. So we need to be more flexible and accept the help that comes to us. One of the things that we identified through this process was a website called Lots of Helping Hands. So that allows you to schedule the care needs of your loved one and then invite folks through social media, through email, to help fill those care needs. So a lot of us might not be comfortable sitting with somebody who has dementia for a longer period of time, just not knowing how to interact with them. But we would be happy to bring groceries or bring meals or maybe help clean the house. There are lots of different forms that help can take that take some of the burden off you, that make your life easier, and that work for the person who's providing that help too. That Savvy Caregiver program that I mentioned before identifies 5 different kinds of family caregiving situations. There's the solo situation where maybe you're an only child, you wind up doing everything. There are tag team situations where maybe you and siblings rotate into the house, or dad moves from one house to another. The situation that everybody wants is a collaborative situation where everybody pitches in according to their availability, according to their interest. And as somebody who, this is kind of my life, I see maybe 2 of those per year, right? So if you're holding out for your family to become that, you're going to be waiting around forever. So you've got to be, again, flexible and accept help as it's able to come to you in the form that, whatever form that takes. We recognize through this process that most of us, probably all of us in this room, live in the gap between having few enough resources to qualify for Medicaid and being wealthy enough to pay for all of the help that we need to put mom or dad in an awesome facility or have 24-hour home care from somebody that we love come into our home and take care of all of their care needs. Something that is a resource for us in that gap there between Medicaid and private pay are your senior services. So if your loved one is 60 and older, they qualify for this regardless what their level of income is, what your wealth situation looks like. And that means things like congregate meals at the senior center, home delivered meals when they can't get to the senior center. It means transportation. In some cases it means adult daycare that is either free or on a sliding fee scale. All of that is available to you through your senior service providers. And it's not all encompassing, but if you don't have to race home from work to make lunch for mom or dad, that makes a big difference for you. That makes your life more livable. And so we encourage you to take advantage of those resources. It was identified that we need to do a better job with support groups. So we have a great network of support groups for a lot of disease-specific things, for Parkinson's, for cancer, for Alzheimer's disease throughout the state. And the gap that's there is for people who are doing family caregiving for just an aging parent, somebody with increasing frailty as they're going through life. And we need to do a better job with convening those folks together. Our long-term care ombudsman program provides value for families who have a loved one in an assisted living facility or a nursing facility. They're an extra set of eyes there to make sure that your loved one is being taken care of in an appropriate fashion, and if they have complaints about things like the food or things like the temperature or the way that they're being treated, the ombudsman takes that up with the facility. So we encourage you to connect with your ombudsman if you have a loved one in those settings. Finally, employers, which is one of the central reasons that I'm going around talking to chambers throughout the state. We need to activate our employers in supporting family caregivers who are also working. We talked before about the fact that 3/4 of our caregivers are in that situation, and we'll talk in just a moment about what that means for you as an employer. And here is actually what that means. So for you as an employer, and I'll talk to you from my perspective. So we have about 236 folks, we have 236 people who work for the Aging and Long-Term Services Department for the state of New Mexico across adult protective services and oversight of senior services. And what we heard from them is that they wanted to be able to, when they're on FMLA, whether they're taking care of themselves or taking care of a loved one, they wanted to be able to take a mixture of unpaid and paid leave. The way that our policy used to be was that you had to exhaust all of your paid leave before you could take unpaid leave. I don't have, as somebody running a state agency, maybe the maximum flexibility that you would have in a private business situation. But this was something that I was able to do to allow them to do family caregiving for longer, is change our policies so that they're able to take that mixture. It doesn't cost me anymore. They still have the same amount of paid leave that they had before. It doesn't cost the taxpayers any more money, obviously. But it allows them more flexibility to manage their own time, to manage their resources, to take care of their loved one in a family caregiving situation. So really, it's about what you can do to provide them with the flexibility to still get their job done. You know, if you're a bank and you need people there from 9 to 5, that's obviously, you can't have them telecommuting, right, in those teller jobs. But in some positions where telecommuting is something that makes sense, that might be something that you would consider. And the reasons that, from an employer perspective, it's going to benefit you to support these people, to keep them working for you, is that with unemployment what it is today, I have a very difficult time finding qualified folks to fit those 236 positions, right? I mean, sometimes the lists that we get are not outstanding for the people that we want to hire. And I feel like, by and large, these are pretty decent, desirable jobs. So it makes no sense for me, from an employer perspective, to discount 20% of our workforce, the folks who are doing family caregiving. These are people who are, by and large, responsible, hardworking. They're the folks who step up to take on this extra duty. They have the work orientation that, as employers, I think we want for just about every position that we have. And so from an employer perspective, you would be shooting yourself in the foot not to try to retain these people. And what it takes, again, is a level of flexibility. And now you have an understanding of some of the things that they are facing, some of the needs that they might have, and can take that into account. So for family caregivers, your role in implementation of this plan is to know that we value you, that you are doing a job beyond just what you do for your loved one. That if you weren't there, we know that your loved one would be in a position where they would need more from the rest of the community just to keep them safe. Because of that, because you're doing something for more than just your loved one, for the community at large, we need you to psychologically give yourself permission to get help, right? You're doing something that helps us out. Let us support you in that. If you don't have some other local way to figure out what your needs are and what's available in your community, call the Aging and Disability Resource Center. Make them your first call. Let them assess what your needs are. Let them connect you with resources. The next thing is use those resources that they connect you with. Get training that's available. Get respite. Take care of yourself is the last thing that you need to do. It allows you to take care of your loved one for longer. If you wind up in the hospital or worse, you're not going to be able to do the job that is so important to you, right? They say that you need to secure your own mask before securing the mask of the passenger next to you, right? And that's what we need out of you. And really, if you think about it, that's what you need to do to be able to continue to take care of your loved one in the long run. For those of us who are making decisions about employment, about HR, about how we support our family caregivers in your business, you now have an extra free resource that you can refer them to in the Aging and Disability Resource Center that will help to connect them with all of the assistance that's available out there. Be flexible with them in whatever way makes sense for you is what we ask you to think about. And then understanding the issues that your family caregivers who are working for you face really will help to make you more empathetic, to understand what their situations are, and then to take the steps that are going to help retain them as people who are hardworking for you. So I thank you an awful lot for all of the time that you devoted to listening to this. I really appreciate that, and we can take questions either now, Patricia, or I can hang out. I'm not sure. I didn't check how I was doing on time there.
You're doing great. We've got about 15 minutes for
Okay.
questions. So fire away, guys.
So in the hospital setting, is it the discharge planning department that is charged with this training?
So the law doesn't specify, who within the hospital is supposed to do that. They leave that to each hospital to figure out. But it's something that ought to be getting done. And if you are seeing that not occur, you should bring that up with the hospital administrator there. Yeah.
I wanted to mention that our community has a group of people that are a subcommittee of our health council, and it's called the Older Adult Network.
Yeah.
And we have, for the past year and a half, been visiting with various businesses to help them become dementia-friendly. We have a pretty high incidence of dementia in Los Alamos County. Not quite the highest in the state, but we're close.
Yeah.
And because we have many older people,
Right.
our longevity rate is very high.
Yeah.
And the
Yeah.
two go together. So if there's a business that would like our group to come and do a presentation about how, as a business, you can be dementia-friendly, but also with that added information for your employees who might be dealing with that at home, we found that it's been quite helpful to the people that we've presented to.
That's great, Pauline. That's awesome.
Let me know.
Let's see, Ellen, one thing that made me think of, too, that I did not highlight specifically is we have a Care Transitions Bureau in our department that helps folks move from assisted living facilities, nursing facilities, and in some cases hospitals back into the community, making sure that everything that they need to succeed in their apartment or in their own home is in place for them. So you can call the Aging and Disability Resource Center for that, too. They will also, for folks who are on Medicaid and maybe aren't getting the assistance that they are entitled to through their MCO, through their managed care organization, will advocate with the MCO to make sure that they are doing what they ought to be doing in those situations. Yeah, Irene.
I notice a lot of other states have this, and does New Mexico, where people can take care of people in their homes. They get certified, and you all come and chat.
Yeah.
So that maybe a couple or even a young family, they have a few rooms, and they can. And to me, I'd rather do that than a nursing home. Do we have?
Yeah. So you're talking about board and care facilities, Irene?
Okay, I
Yeah.
know one
Yeah.
in Los Alamos.
Okay, yeah, yeah. So it's somebody who is taking boarders in and providing maybe some level of, right, yeah. Yeah, I mean, so the issue with that is that, I mean, let's see. The challenge there is that those are not regulated here in the state of New Mexico. So there's no, for assisted living and nursing facilities, Department of Health regulates those settings, and there's nothing like that in place for, right, yeah, yeah. Yeah, I mean, those things exist here in New Mexico, and the difficulty there is that they are not regulated. So you know,
Will they be in the future?
you know, that's a good question, Irene. It's something that definitely gets talked about, and I think that the barrier to that right now is really resources.
Okay, thank you.
Yeah. Yeah.
You know, there's such an emphasis on healthcare today.
Yeah.
There's such an emphasis on educating students to play in healthcare roles.
Yeah.
Besides, you know, nursing and doctors, there's home care. If we look at resources that might be interested in home care,
Yeah.
is there a contact within your organization that might be a good one to facilitate a student internship? We in Los Alamos
Yeah.
are very fortunate to have a community collaboration
Okay, yeah.
initiative that we can match students with businesses
Okay.
to educate
Okay.
students.
Right, right.
The funding would be taken care of
Uh-huh.
through another initiative,
Uh-huh.
but what we can do is create for students that are interested an opportunity to fill a role.
With home care agencies.
Yes.
Yeah, yeah, I think that we can help you to get that figured out. Yeah, yeah, we don't have something that exists for that presently, but if you go ahead and give me a call and I'll give you my card, we can work to assist you with that. Yeah, we have a great internship program right now for folks who are looking at adult protective services as a career, but we don't directly do home care, but I can help you figure out who you might contact.
Okay.
Okay, that's a great idea. I think that the issue that you bring up there is that we have giant challenges in terms of workforce and healthcare workforce, particularly in rural New Mexico. I mean, once you get outside of Albuquerque, Santa Fe, Rio Rancho, Las Cruces, we have a very hard time filling all of the needs that need to get filled there. Let's see, yeah.
You talked about the assessment that a caregiver would go through.
Yeah.
In your agency.
Yeah.
How does that work? Where does that happen at?
So if you just call the Aging and Disability Resource Center, they can do it for you over the phone. If you have a more complex case, what they use are members of our Care Transitions Bureau that I mentioned before. They can do it over the phone or in many cases come out and do it for you in person. And one of the things that I didn't mention specifically is that in order to address the rural challenges that we have all over the state, we wanted to make sure that things are available over the phone, online, and then in person too, because we know that people's time is extremely limited as family caregivers, that often you're just trying to get through the day so that you can collapse into bed, and then maybe that would be the time that you'd be able to get online and Google up resources, or maybe you can call from work during lunch and access the ADRC, but we wanted to make sure that things are available through a variety of different mediums for people. Anybody else? Please.
So I'm just wondering, are there waiting lists for some of the, for instance, the respite?
For respite, for adult daycare, we, at the end of this fiscal year, talked to the providers of that and took care of the waiting lists to my knowledge. But they sometimes pop up throughout the state. By and large, I think that we're in pretty decent shape for that. As many people as we know are out there that need adult daycare, we've had a difficult time historically, keeping adult daycares financially viable and in business. And so, for people who are entrepreneurs, we did a study of adult daycare through the New Mexico State University, where they looked at what you need to be successful and sustainable as an adult daycare. It comes down to having a population of about 20,000 people that you're trying to serve, using a diversity of funding sources, including Medicaid, senior service funding, and then private pay, and then continuously doing outreach too, that they need to market all of the time. But you can get an answer as far as adult daycare or respite resources through the ADRC too.
Okay, yeah, this is very good information.
Thanks, Trish.
And I just want to let everyone know that I am an Ameriprise financial planner.
Oh, awesome.
One of the best things you can do is I offer a free consultation, a complimentary consultation. Is just come and check and see if there's a lot of ways to structure long-term care or chronic illness coverage. So it costs you nothing to look at your options.
Great.
You could do it for your family.
Yeah.
I just want to say, we're taking care of my 92-year-old mother with dementia, but the senior center has been a godsend because I was able until last week take her to the day out so she'd have good care during the day.
Yeah.
Do all my volunteer.
That's awesome.
But now her legs don't work. So last 2 Mondays we've been in the emergency room. Today I'm taking her to the doctor again. So I can't take her there because I wouldn't, she's falling now. All the time. The legs just don't work anymore. So this respite care, without using a senior center now, is what I might be interested in.
Yeah. Call the ADRC, Irene. And
This is the number I can call.
Yep. And we have brochures available for you too. Yeah. Thank you for doing that, Irene. I appreciate that.
I just had a question.
Please.
It's really interesting that all of this happened this morning. The reason I was late is because I was helping my mother-in-law navigate a plane ticket that she was going to travel actually with us. Tomorrow, and now we just found out we have a family member went into hospice yesterday.
Oh boy.
And so I just want to, as a well-being coach, I work a lot with folks helping them navigate this and the importance of education and raising awareness and customer service on a business end when you are navigating this type of a situation is incredibly important. Fortunately, I had a beautiful customer service experience with the airlines and everybody I kind of was navigating this morning before I came here today. And so I just want to, as business owners, we have a responsibility and a privilege to provide that in our community, just that nurture that oftentimes is missing in a time of challenge.
That's a great point.
And so I just want to thank you. I'm sorry I missed your entire, I'll watch it on Pack 8, but just the importance of this, raising the awareness and the acceptance of this issue in an aging community, it's incredibly important.
Like, can you take oxygen on an airplane now?
All of these things, right, Irene? I mean, we just need to, to even have like a top 10. That people can click and go, yes, this is some things that I need to pay attention to as an employer or as a local business owner. This is really, to provide the best care I can for the people that are in my environment. So thank you for bringing this, to our community and shining a light. A lot of people don't like to talk about that this can be a problem.
Maybe my favorite topic.
I know you can tell, and I love that about what you shared. So.
Oh, thank you, and thank you all for the opportunity. I really appreciate it. Any final questions? Okay, I'll hang out afterward if there's anything else that you want to bring up. I really appreciate again your time, and thank you, Patricia, for the opportunity.
Nancy.
Oh, boy, Nancy Patritz. I'm sorry.
Thank you very much.
Thank you, Nancy.
Thank you all for coming.